good? It's Dr. Leonard with Central Ohio Spine and Joint. So I've got a cool case here today I wanted to share with you. So this patient here came in to see us today with some pretty acute back pain. It was as the result of some weightlifting she had been doing throughout the week this week. And I wanted to talk about something that commonly happens with weightlifters, especially people who are doing kind of high volume to fatigue type lifts that you would see in something like CrossFit. Even in some of the other workouts that we see, people are going, high volume, even high weight, which can place a lot of strain on the back. So what I did was I wanted to bring a model in here and just to show you exactly what happens when people go into kind of spasm in their back. So when you're going through a movement like a squat or a deadlift, what happens a lot of times is as you start to fatigue, you start to break down and use a little bit more of this low back versus using the hips, which you're designed to use. As you start to fatigue, there are these deep little muscles that help control the movement within each segment of the spine. Some of the muscles are called the multifidi. There's little ones pretty much on either side. There's a number of different ones. As those muscles start to fatigue, what happens is your body then starts to sense some instability in this segment. You're getting way too much movement as you're going through the lifts. And then as a result, either when you're done or when you go, let's say you go to pick something up and those muscles are fatigued, your brain recognizes that instability and in turn turns on those muscles and creates a lot of deep spasm. And so when people feel like their back locks up or it grabs on them, that's the feeling of your muscles going into that spasm. It's actually trying to protect the area because that spasm locks the area down. But now as a result, pretty much every single movement, especially like twisting or turning or sitting, becomes extremely painful. So what I'm going to do today to help treat this, so we already went through a little bit of manipulation, some stabilization work to try to get these muscles to calm down. But a really, really good treatment that we also use is dry needling. The needling actually goes into those deep little stabilizing muscles to help them release and relax, hopefully giving her a little bit more long-lasting relief from some of this discomfort. After this, once we get the needles out, it's all about kind of grooving that pattern and reminding her brain that there's not instability here. She just sensed that once she had some fatigue. Let's say she were to just kind of go about her day and not go through any of this treatment, that spasm has a good chance of not going away and now creating longer problems down the road once she goes to go back to exercise and lifting. So what we're going to do here is we're going to do a little bit of dry needling. It's very, very non-painful. It's a very simple process. These needles are going to go, just into the surface a little bit. They don't go very deep, but we are going to try to get them down into those muscles that are creating some discomfort. So right now we're at kind of the L4, L5 segment, and we're going to go on either side. We're going to place 2 needles on either side. You're going to see by her reaction, most people don't even really feel the needles go in. Last one. Good, perfect. Okay, so like I mentioned, once the needling's done, we'll kind of help groove that pattern a little bit more, help those muscles release and remind the brain that she's more stable in that position. We'll send her home with some stabilization exercises. So if you guys have any questions about specifically, back pain with weightlifting or anything about dry needling, make sure to either leave us a comment, shoot us a message. We'd love to help you guys out.